also like to welcome Adiaro, Mrs. Grace Sogolo Okotie, Secretary, College of Medical Sciences. You're welcome, ma'am. We also welcome, especially, Mrs. Agnes Ndidi Uho, DR in charge of Labor Relations. We welcome you. We also welcome you, ma'am, Mrs. Anwuli Owaje. She's the Deputy Registrar and she's in the Technical Neurology Center. Please put your hands together to welcome this person. Other DROs have been recognized already. Person of the SDR, Mr. Harris Osireme, and also, I just saw walking into the auditorium now. Ladies and gentlemen, another DR is in the house. Join me to welcome an astute administrator, Mrs. T.M. Omageume. You're welcome, ma'am. Please come to the front. There is a space for DRs here. Thank you. So I'll go straight to inviting the ANUPA chairman to give a brief welcome address. Join me as we welcome to the podium, or the microphone should come to you, sir. Mr. Duke Itoche.
Distinguished colleagues and seniors, I want to welcome all administrators, administrative officers, and executive officers for this ANUPA lecture series and health talk. I bring you greetings from the National President, Dr. Victor Ben. Greetings from our registrar also, though his representative is here. I want to welcome all of you to this lecture series. I remember during our swearing in, we did promise and actually said that there's a rebirth of a new ANUPA. We actually promised that we are going to reposition ANUPA and bring ANUPA to a greater height. Yes, there are some issues that we have here in the University of Benin. At this our last AGM in council, there were a lot of waivers that were given to us at that council meeting that has to do with our certification, recapitalization, and all other issues that we have with the national. During the council meeting, the national president did report that ANUPA had been outside the national activity at the last 2 years backwards. We were not well represented. He gave his report, and council actually gave waivers to some of the demands that I presented to council for a waiver. Those things I cannot mention here now because the registrar is not around. We did need his approval before we go ahead. I want to assure and plead for the support of all ANUPA members. We are scanty here now, but when those that are not here want to criticize, it will be very, very, very easy. We should not criticize, we should join to rebuild the position ANUPA. In the course of the new year, by the special grace of God, we have a lot of activities lined up for all cadres, faculty officers and others. The registrar's rep here is here. She's going to give us some lectures on how to go about presenting memos in Senate, most especially when it comes to the issue of results. And faculty officers are the ones that are actually called upon at that point when it comes to presentation of results. Presenting results when those heads of departments are doing the wrong thing, faculty officers are actually supposed to correct them. So in the course of the coming year, we are going to organize programs that will benefit each cadre. So I want to plead with everybody, like I always say, complain never solves problems. We should learn to solve problems and not complain. We should join this ESCO to move ANUPA forward. Thank you very much. But before I want to actually use this opportunity to thank our guest speaker, Dr. Saibovo Usaro Emmanuel. He has been of help to this association. Most of the things we do here is pro bono. He's here today at no cost. At no cost. I will say this, when we are to go to Abuja, I said I should fly. I said support me with the money to fly. And he actually support me. I can't be flying when my members are on the road coming. And of course, we don't have funds. We don't have funds. Where other universities are collecting 6,000 and above, we are collecting 500. It's really hard feeling, but when the registrar comes, we will review a lot of things and we will get back to you all. My senior deputy registrar, I want to also use this opportunity to thank you for all your support. I want to also use this opportunity to thank our PRO here and all the PROs seated. College of Postgraduate Studies, training, Mr. Wadia Koti and our DRO, of great assistants. And my colleagues, the faculty officers, they were very, very wonderful. Lusa, Sangbedo, Mrs. Ubeawaifu, my treasurer, my secretary, my vice president. I want to thank everybody to solicit for your support. Thank you very much.
Please give it up for our chair. Thank you so much, sir. Okay, so before we receive the registrar's remark, I want to quickly welcome other DROs. Ladies and gentlemen, please let us receive warmly the presence of Mr. John Osagi. And also, another DRO that you cannot miss his face. Ladies and gentlemen, welcome Mr. Abu Fatai. Thank you. We will now receive the registrar's remark from the Deputy Registrar in charge of Senate Matters, Mrs. Comfort Inyeguvena Eligato.
Good afternoon, my esteemed colleague. The registrar is away and he requested that I represent him here. I welcome all of you. All courtesies duly extended. I just want to raise an eyebrow here that we are all administrators, and as administrators, well, we are the ones that we are really, usually the secretariats of meetings, and as the secretariat, you are supposed to go early for your meetings, at least before the members start arriving. You can imagine here now, ANUPA members, how many are there, Chairman? There are very many, 407. I'm looking at this, I'm not sure we are up to 100 here. It's so sad that as administrators, and with this topic that our SDR is giving, it's really very nice for us administrators to be here. But look at the number of people here. And he said you have to be on top of the game, you know, and fewer than 1 quarter now that is here. It's so sad that you are all trying to, okay, just like the chairman said, that you criticize and criticize and criticize. And we are bringing up things. He has brought up novel ideas, you know, just to make us at least to be on top of the game. And look at the number here. It's so sad. Please, when you all go back, for those that were not here, you tell them that it's so wrong of them. It's wrong that your association will call for meeting, will call for seminar, workshop, and they are not here. How do we now learn? They said the only thing that is constant is change. You all have to start learning. Nobody is too old. Even we as DRO, we learn every day. So it's good for us to always attend this meeting. You can imagine the registrar is already talking and everything. It's there, you are strolling in. It's wrong. At least we should accord the respect like that. And I want to thank the ANUPA chairman for this. He said the ANUPA is repositioned. And really, with this health talk now, it's really repositioning. So we thank you, chairman, and we pray sustain, because all of us we want to be healthy. So we want to have, at least for every ANUPA now, everyone, we want to have an health talk so that we all know how to be able to keep fit, because these days so many things happening and we want to keep fit. So I want to, it's not a long speech, I want to urge you to kindly listen, and whatever you have learned here, please put it into practice. Thank you.
Thank you, Madam Registrar. We appreciate those remarks. So for everything she has said, if there's nothing you did not hear, you should hear this one. As you are coming, tell a colleague, follow me, let's go to our meeting. As you are coming, for every department you are, faculty, for every office, let's rebuild this ANUPA. It is for us by us. Thank you, ladies and gentlemen. Please, we'll still quick your indulgence. Let's sit together. We are not looking good on the camera at all. And you know this program is going, it's live stream. We are not looking good at all. So there should be no space in front of you. Don't still, please, those at the middle, please come. Please come. Let's fill in the gap. Also, this way on my right hand side, please, let's come. Because it's not looking good at the camera at all. This is Uniben ANUPA conference and the live stream is on. So that was one of the first things the registrar's rep said. Come with someone. Let's encourage one another to come. Then number two, she talked about the health talk. And that is why we are going to receive first the tips that Dr. Osaro Osaibobu will be talking to us about prostrate disease, the new family challenge in Nigeria. Ladies and gentlemen, can we welcome very warmly the Acting Director, Textron Urology Center, University of Benin. Please put your hands together for him. If you feel you don't need this topic, you don't need the tips, someone around you might need it. So let us pay very good attention. Thank you.
Thank you. Thank you. Okay.
Let's go.
Chairman, ANUPA, Uniben branch, the registrar of the University of Benin, ably represented by the Deputy Registrar Senate Matters, our senior Deputy Registrar, Mr. Mario Saye, Deputy Registrars here present, the Executive of ANUPA Uniben branch, ANUPA members here present, ladies and gentlemen. Again, my name is Emmanuel Osaro Osaiboso. I like the way Tracy was introducing me because people hardly call me Osaro. So when I hear them call me Osaro, it sweets me in my belly. The baby in my womb will leap for joy. I'm happy to be here to give this lecture today. The chairman is my bosom friend. I know he will be happy that I call her dead bosom for the first time today. So when he said I should come, I was happy to be here. Although we had a little argument about the topic. He wanted a topic that he thought everybody will gain from. And I told him, this topic, everybody will gain from it. Because everybody is involved. Because there's a lot of misconception about what prostate disease is, especially in Nigeria. I don't know if, okay, yeah, thank you. So, I'm going to start now. Next slide, please. As a means of introduction, as I said earlier, I'm going to highlight the importance of understanding what prostate disease is and how it affects us, especially addressing the misconception that are really going around in our country today. Because understanding the disease will help us and improve treatment outcome. Next, projected the anatomy of the prostate. If you see the arrow pointing to the prostate, the middle one, the magenta colored one. Thank you very much. The magenta colored one under the bladder is the prostate. The prostate is not a disease. It's an organ in the body Because most times you hear, say, ah, doctor said I have prostate. Prostate itself is not a disease. It's an organ in the body, under the bladder. And actually, it's the man's womb. The prostate is the man's womb. I know many of you say, it's the man's womb. It's one of the reproductive organs of the man. Next slide, please. And in this next slide, I try to compare the male reproductive. No, please, back. Thank you very much. In this, I try to compare the male reproductive system and the female reproductive system. If you look at where the prostate is for the men and where the uterus, which is the woman's womb, is for the women, you a little similarity. The difference is that the prostate is under the bladder. The bladder is the bag that carries the urine until the person goes to void. While in the female, the womb, which is the uterus, is behind the bladder. The pipe that brings out urine for the men goes through the prostate gland. That's why most times when the prostate gets enlarged, the man starts having urinating symptoms, which we call urinary symptoms. Next slide, please. The main function of the prostate gland, as I said before, is the mouth womb, is to produce parts of the semen. If I may say again, the semen is different from the sperm. The sperm is the cells inside the thing that the man produces during intercourse, whereas the semen is everything. The sperm is produced by the testes, which in local parlance they call the coconut or the brocos, or by Odineje, the sokoto. So, produced there, then the prostate itself now produces the fluid which encompasses the semen. In that fluid you have what the sperm feed on, like the fructose. Those of us that did chemistry, we know what fructose is. It's a type of sugar. That's what the sperm feed on. The prostate also produces other things like the PSA. Next slide, please. Like the PSA. The PSA, you must have heard the doctor, some of you that have visited the urologist before, any doctor has say, oh, you will need to do a PSA test. PSA is not a disease by itself. Sometimes say your PSA is elevated. The person will be complaining about, doctor, beg, what do I need to bring the PSA down? PSA is not a disease. What PSA means is prostate specific antigen. It has a specific work in doing the body. Those that have seen the semen before, both men and women, if you have seen the semen before, when it comes out of the man, it's usually thick like pap. If you leave it, it becomes like water in the next 2 to 3 minutes. What makes it to liquidify is the PSA. And why God did it like that, when it's in the woman's vagina, it liquidifies and the sperm inside the semen will be able to swim into the woman's uterus to go and fertilize the egg. So as you can see, the prostate produces a lot of the reproductive things, a lot of things we needed for reproduction. And the PSA that you have heard of is not a disease, but something that we use to look for disease. Because by the time the prostate is not disease, the prostate will produce more PSA. Next slide, please. The prostate, as every other organ in the body, can have different kinds of disease. Prostate is affected by a lot of diseases, but the 3 most common ones is what I've listed here. The first one is prostatitis. Prostatitis means inflammation of the prostate, and simply put, the most common inflammation of the prostate is when there is infection in the prostate. So that is what prostatitis means, inflammation of the prostate. The second one is benign prostatic hyperplasia. As I put in bracket there, non-cancerous enlargement of the prostate. And this benign prostatic hyperplasia, popularly called BPH, is the fibroid of the prostate. So you can see the similarity between prostate and a womb. The prostate too can have fibroid, and the treatment is almost the same way. The only difference between, yes, it's almost the same, but if you have fibroid, usually as a woman, fibroid can prevent you from getting pregnant. If you have fibroid for a man, which is BPH, it can block the pipe that urine comes out from, and the man start having difficulty passing urine. And the third most common one is the prostate cancer, which is the malignancy of the prostate. This is the one that worries both the doctor and the patient. Next slide, please. For prostatitis, the common cause, as I said, is infection of the prostate, and the most common cause is bacterial infection. Although some other causes can happen, like for instance, when there is injury to the prostate, maybe from accident, the prostate can come without with inflammation and have prostatitis. What are the risk factors for developing prostatitis? Like men that couldn't pass urine, sometimes the doctors will put catheter, they put in rubber in their penis to help them to be passing urine. So when there is foreign body around the prostate can develop prostatitis, either because of the pressure of the catheter or the catheter itself is introducing infection. Secondly is unprotected intercourse. When especially those that have extramarital sex, or even when you are not married, if you have sex with somebody that is not just attached to you completely, a person can spread infection to you and it can affect your prostate as part of the reproductive tract. Then 3, if you have done operation around the prostate. Next slide, please. Okay. This is the one I said is the fibroid of the prostate. And as I said, it's a non-cancerous enlargement of the prostate gland. Normally, once a man is beyond 40 years, especially if you are a black man, your prostate will start increasing in size. Not because of what you do, it's just because that is how God has created us. You start responding to the influence of testosterone and it starts increasing in size. And when it is increasing in size, it will start blocking the pipe where the urine comes from. If you see the one on the left, that is the normal prostate. You can see how it's open. The urethra, that is the pipe that brings urine out. It's very open. But when it's now very enlarged, we start compressing the urethra and the patient will have difficulty urinating. And as I said before, once you are getting older, your prostate starts enlarging. So the risk of developing benign prostatic hyperplasia is higher. Then if you have a higher testosterone level, you may develop BPH too. Next slide, please. For the prostate cancer in any area of the body is the same thing. The way God created the body, there are some parts of the body that keep growing and don't stop growing. Like our hair, like our women, you want your hair to grow long. Your hair will keep growing. And I know some of you have marijuana to it so that you can grow. So the hair keeps growing. That's why men keep cutting their own. And like our fingernails and toenails, they keep growing. If you don't cut them, they will keep growing. But the other body, like our eyes, our fingers, they don't grow, our nose, they don't grow beyond what they have grown for. If you remember your nose and your eyes, the way they are 30, 40, 50 years ago are still the same size they are, because the body has regulatory mechanism to make them not grow beyond that, despite you are eating and nourishing them. But sometimes this organ will lose this regulatory control and they start growing uncontrollably. That is what is called cancer. And it can affect any organ in the body, including the prostate. So when the prostate has that uncontrollable growth of cells, we call it prostate cancer. And if you detect cancer on time, if you detect it early, before it goes beyond that organ, you can achieve a cure. Any cancer in the body, including the prostate. So we preach early detection. How do we preach early detection? When you go for medical checkup every time and they do screening for you. Anybody, even if it's breast, cervical, the earlier you get it, the better. But what are the risk factors of developing prostate cancer. As I said, by the time you are 40 years and above, your prostate starts growing. And by the time you are 50, 60, you have a higher incidence of developing cancer. So prostate cancer is found more in elderly men beyond 60 years than people lower than 60 years. Then if you have probably your father, your dad, or your elder brother have had prostate cancer before, you have 4 times 4 chance of having prostate cancer than the general population. That means my father have had prostate cancer before, and my dear father have not had prostate cancer. If I have 4 chance of having it than him, then if my uncle have had it before, I have 2 times higher chances of developing it than any other person. Then, if you are a black man, prostate cancer is our disease. But unfortunately, we have not been able to develop better treatment for it. All our treatment we give are treatments that the people from Northern America and Europe give to us. And the reason is because our governments are not supporting medical research. Next slide, please. This is just a diagram to show you how bad prostate disease is. If you look, Nigeria, those of us that know geography very well, if you see Nigeria there, everything is green. And if you look, which one is green? Prostate cancer. So what it means that for Nigeria, prostate cancer is the #1 cancer for men. Prostate cancer will kill more people than lung cancer or colon cancer or intestinal cancer, any cancer in the body. Prostate cancer will kill more of Nigerian men than any other cancer. Next slide, please. So I want to talk about the symptoms, and before the symptoms, I need to say prostate disease, whether it's by infection, inflammation, the fibroid one, or the cancer, their symptoms are similar. Please, I repeat, their symptoms are similar. So until the doctors check you and probably do some 1 or 2 tests, it cannot really tell you what it is. Now you cannot make a diagnosis for yourself. Not because I have those kind of symptoms, I've done the test and they say I have cancer. So when he told you, now the same symptom, you will not think his own is cancer too. It's not the same. As I said, many disease conditions can affect the prostate gland, just like any other gland in your body. And the first, and most times the most common one, is poor stream of urine. If you see the picture there, I put a young and an older person. If you know when you were younger, your urine can put hole in the sand. Then as you are growing older, the urine, when you are coming closer to you, as they said, when you are growing older, you'll be coming closer home. That's what the urine does too. So what it means is that your prostate is blocking that pipe that goes through it where urine comes out. So urine flow is not as good as before. Then if you notice before, as a young man, when you just finish weeing, you just put your mouth back into your trouser and move. But now, if you are over 40, 50, 60, you will sometimes have to shake and shake and shake the hell out of the thing so that it will not wet your underwear. The other symptom is urinary frequency. You find out that every time you find yourself going to wee. Some people here may not be able to stand this whole meeting without going 2 times to go and wee. You find out that in the night, you're only getting up several times to go and wee. And for the women, you no longer have good sleep because your husband will keep getting up and disturbing your sleep. You yourself, you are not the one going to wee, but you are not having good sleep because the husband God has given to you is just waking up 3, 4, 5 times at night to sleep. Because most times when our patient comes to us, oh, okay, how many times do you wake up in the night? The man say, okay, like 3 times. The woman say, I beg, keep quiet. It's 7 times. Because you are the woman, you are the one counting, because you are disturbing your dear sleep. So next slide, please. Some people too, we have one we call urgency. Urgency in the medical, from the word urgency. There is urgency. The man cannot hold the urine. Most times, the way God created the bladder, when it's getting filled, you can resist it. If you feel urine coming, you can hold it for the next 2 hours, enjoy the lecture. The people that have congestion, no, they will get up and run to the toilet. And some of them, before they get to the toilet, they will wet themselves. That is what we call urge incontinence. So you see them running, especially elderly people run. And some, when they get to the toilet, when they want to wee, the wee will delay before it starts coming out. Some men will not start whistling. Not that they like singing when they are in the toilet too. They are just using that to keep time and wait for the urine to come. We call that one hesitancy. We blow. It takes some time for the urine to start. And when the urine starts flowing, it doesn't just flow once and finish. It will flow, stop, start again, flow, stop, start again. That one we call that one intermittency. We have stop and start urination. Next slide, please. So we find out that after they do the stop and start urination, they are back in the toilet, they zip up. They will not be feeling, they don't finish urinating. They won't mind feeling as if I have not finished urinating. Because the prostate is now blocking the opening of the bladder very well. So the bladder is not emptying completely again. So we call that feeling of incomplete voiding. Some we have pain when they are urinating. Usually that is when there is infection. When you are urinating, you have pain. Some think they have gonorrhea. Sometimes it's not gonorrhea. It's just you have difficulty urinating and there's an infection in your urine. We call that one dysuria. Next slide, please. Then when you go to the toilet, this is very scary for patients. As you are weeing, you see blood. That one, I know that one, they don't, most men will not go to the issue. They will not drink pawpaw leaf and shower shop leaf. They come to look for the doctor because that one is very scary. And usually it's when there's infection, following stasis of urine not coming out well, before you know it start bleeding. Or when they have intercourse, to see blood. That one is scary both for the man and for the woman. The woman starts shouting, yeah, there is blood. The woman will never allow the man to near her again. You can see how it's going to affect the family. Then, some people start having bone pains. Bone pains usually is associated with cancer of the prostate. When you start having all symptoms and you start having bone pains, sometimes our mind start going that I hope this person don't have prostate cancer. But the truth is that if you have lower urinary tract, all those symptoms are discovered and you now have back pain, it does not necessarily mean you have cancer, because as you're having all these symptoms, the other symptom of the back, because as you are growing old, every day driving in traffic, running around the walking on campus, our spine is being overworked. You may even have what they call lumbar spondylosis. So you need a doctor to review you and say, okay, that back pain is related to your prostate symptoms. Then some people start losing weight. So these are all the symptoms of prostate cancer. So the next slide, the next one is, okay, prostate disease, as Dr. Saigova said, is our lot in Nigeria. What challenges does it give to us? Prostate disease, as I said, particularly the cancer one and the BPH, have significant impact in the family. As I was mentioning the symptoms, I've already started mentioning some. Like for instance, if your husband has prostate problem, waking up several times at night, it will affect you this fast. Because you yourself, you wake up in the morning, start having headache. You will not want to feel like coming to Ugowa campus because of that. And usually we call it relationship disease because of the way it affects the relationship at home. It has both psychological, social, economic, and cultural effects. Next slide, please. Some of the social economic effects include war, lower screening rates. As I said before, the best way to treat a cancer is to catch the cancer early, whether it's brain cancer, eye cancer, breast cancer, cervical cancer, or even prostate cancer. But in Nigeria, our screening rate is very low. Abroad, they do general screening for every community. They just go and screen. And the easiest tool to use to screen is what they call serum PSA. But in Nigeria, PSA costs about 20 to 25,000 naira, just a single blood test. How many people can afford that? Then in US, it's free. On your birthday as a man, the hospital will just call you and say, "Happy birthday, sir. Mr. Itoje, when will you like to do your 2025 PSA test?" You will not say, "Oh, I will come tomorrow," or "I will come next week." In Nigeria, how many times a doctor or a nurse will call patient? The doctor and nurses are looking for a budget that they will use to buy, and the government is not making any effort to increase our bill. Then sometimes the doctor will ask you to do an MRI. An MRI, this picture I put there is like that is how MRI look like. It's not something that they will roll you into the machine. An MRI costs like 120,000 naira in Benin. Then sometimes after MRI, the doctor will now say, "I want you to do PET scan." In Nigeria, they do PET scan, okay, now in 2 places. And it costs $1,000. You know what $1,000 is? A minimum of 1.5 million. Any of us are receiving that as a monthly salary. Then access to healthcare. I just returned on Saturday from our association annual conference in Lagos. And I looked at our register. We were 187 urologists for a 230 million Nigerians. Because urologists, we treat both male and females. In Benin, we are only 8. In Edo State, we are only 13 for the number of patients that we see. If you have come to my clinic before, I run clinic on Friday in UBTH. It's like crusade. When he told you want to come on Friday, we say, "Hey, your crusade don't end." I'll say, "No, we still do." Sometimes I stay up to 9 p.m. seeing patients. So access to doctors and specialists is very low because the number of doctors are not there. And as I'm saying, maybe by February, instead of 8, we may not be 6, or 2 may have jackled again. Everybody is living. Even me, I may not even be here. So I like good life. Then, it's expensive to access care. Very expensive. Abroad, people don't pay out of pocket to access care. It's insurance. It's insurance that does all those things. But in Nigeria, what is the NHIS like? It's a scam. It's a scam, especially those of you in Union Benin. What is it? Mr. He told you, why they call that your NHIS? Ultimate, thank you very much. You know what ultimate care can do to us. So it's a scam. It's a big scam. Most of the treatments for prostate disease are expensive. If I want to do prostate operation for the one I call fibroid, that is the BPH, if you are doing it in UBTH and you are paying out of pocket, it will cost you between 5 to 600,000. If any child is helping you, you pay like 200,000. Then if you want to do it in my private place, it may cost up to 2 million naira. You can see how expensive it is. That is just for the one that is fibroid. I have not talked about the one for his cancer. There is a patient I saw last 2 weeks. The drug I prescribed for him and I helped him to procure was 1.3 million every month. I'm going to continue it like that if you want to remain alive because of the cancer. So that's why we preach, let's catch the cancer early. So that is how barrier to healthcare is. Many aspects is very serious. The funding, the specialists are not available. Next slide, please. Then this one, lack of awareness. When you don't tell your friend that, don't they wake up several times, they please so. The thing when they come out, they say, no worry, no go hospital. Then they teach you time for hospital. I will give you just mix pawpaw and shawashon. Within 1 week, you know it. I never see internet. Go buy Forever Living products. And most times, because people are not aware, they don't get to the hospital on time, and by the time they are getting there, we'll say it's too late. Say the disease is now advanced stage, and the only way you can remain alive is to be buying drugs of 1.3 million every month. If you feel sure, you say, let me do that so I won't finish the family form and finally still die and live them in wretched life. Next slide, please. As I said before, the cost is too expensive. Then for the patient that is ill, you will not be able to go to work. That means the Uniben, if the person is a PAR, his job will be lacking. Especially here that when you are working, not your baby abroad, you just have to. Then yeah, you find out that your work will be lacking. The person under you will not be doing your work, and the person will be swearing for you. I don't know the kind of sickness where you get. You can't put me for this kind of work. Next slide, please. Then the patients, out of fear, oh, will I die? Panic will come. Will I able to pay for the treatment for this condition? And everything, you'll be thinking, oh, will this not affect my family? Before you know, you are depressed. Next slide, please. And everything around you, you become angry with your wife, angry with your children. You manage to come to work when your superior tell you you are angry. And they say, I will give you query, and not the query you want to give, because in your mind, the query is less than the condition you are having. So you become cranky, everybody, you hate everybody, and before you know, fatigue will set in. You don't feel like, let me just die and let this condition end. Next slide, please. Prostate, as I said, is part of the sexual organ. And when there is disease in prostate, there is up to sometimes significant effect on the sexual function of the man. The man will now find out, trying to wake up the organ will not wake. When the woman is tired of waiting, she will just get sleep. Tomorrow when the man tap her again, hey, don't disturb my sleep, let me sleep. Now the thing will not wake up. You keep me here for 2 hours, I will still sleep up. So most times, relationship will start getting affected. Then the man, because of that, self-esteem will start going down. We start avoiding social function. And you know, women, let me tell you now, most times when men gather and they drink beer, the next thing they talk is their sexual performance. Although many will lie, but that's what they discuss. And because you know it will be discussed, if you start having sexual problems, you won't want to go to that gathering. When they say, let's go to no gathering, you say, no, you have prayer meeting. Next slide, please. Your relationship with your wife, relationship with your children start getting strained. Then if it's prostate cancer most times, by the time it's eating you, you'll find out that you become paraplegic, you can't walk, you'll be on wheelchair, you may need to carry it to where you will take your bath, feed you, all those things. You will lose your autonomy. If you are a agile mind that jump around, you'll now find yourself, now me be this. That you need somebody to carry you around, somebody to bathe you. You lose your total, you lose the autonomy of your physiology and you'll be depressed. Next slide, please. You find out that you don't sleep well again. Your appetite will be poor, either from the disease itself or from your depression. Next slide, please. Social-cultural. You know we're in a very cultural environment. People read meaning to it. For instance, women, when they find out that their men wake up several times to go away, especially if when they were young, she never trusted the man. And then the man is getting up several times and say, hey, don't go carry infection, come. We never allow him touch her. Hey, go meet that your girl will give you the infection. No? When you treat and finish, you come back. Whereas the man will have been prostate disease. And until you treat it appropriately, it will never finish because it's not infection. So most times, sometimes when the man even come to see the urologist, the next visit he will carry the woman and bring the woman and tell doctor, let me explain to her so that you allow me touch her. Because most times the women will say, no, you want to give me infection. Then some people will think, the men will think, It's because they are dragging family land. That's why they are poisoning him. It's his younger brother who wants to carry the father's house that want to kill him. That's why he now gave him prostate disease. Let's like this. Before you know, the man is stigmatized. He won't want to tell people his condition. Doesn't even want to discuss with his close relative. He will lose his self-esteem, his identity, because men, in sexuality that we think is our masculinity, and a man, if he does not have that, he will start losing his erectile function. He will take his main function is gone. As in Benin, now the men used to say that it's two heads they bring to life, that the two heads will go the same day. I don't know where that one came from, though. Next slide, please. Then religion comes in. Religion is a very serious thing in Nigeria. Your pastor will tell you, don't go to the hospital, I will pray for you, and you will receive healing. Whereas the pastor himself is seeing his own urologist. I had the pastor that came to see me in UVTS. When he came, he said the crowd is too much. That if his members see him here, they will not have faith in God again. And I said, you are the one lying to your members. You are delaying them. He said, I should give them my private hospital. I don't have. You will remain here or go and look for another person. Because most times we deceive ourselves culturally and religiously. Then some will believe so much in faith that only water, once you drink it, the prostate condition will go. Then it distrust in the medical system. This one is multifactorial. One, we don't believe that the drug that they give in the hospital work. Then two, you go to the hospital to see the doctor, you get there 8 o'clock, you will not see the doctor till 5 p.m. You won't want to go again the next appointment. Then thirdly, Nigerian health workers, sometimes are on their body. We are rude, we are saucy, some of us. So we don't allow patients to have that confidence in us to come back. So these are things that causes distrust in the medical system. Next slide, please. How does this affect our family members, those of us that have prostate condition? As I said before, once you start waking up several times, your spouse will not sleep. You will wake up having a headache. She will wake up having a headache. She won't want to go to work because she will feel like one that has malaria because you have disturbed her sleep. Normal marital activity will be affected. So everybody become depressed in the house. Next slide, please. The family member, either the spouse, the wife, or the children, sometimes come with anxiety and fear. Oh, I hope this disease will not kill this man. This man, then I told him, oh, let me get a better job. Oh. He said, no, if this will be Unibank clerk, where they pay me 150,000. How am I going to take care of 6 children if he dies? You start getting afraid. The money we have will be enough to procure the kind of treatment that the doctor will suggest. So those kind of fear and anxiety will come. Before you know, you as the relative start getting helpless. And by the time you get helpless, you become depressed. Next slide, please. And when you are depressed, you become frustrated. Every little thing, you see the man talk, you say, I beg you rest. Don't wait for see this kind of bad sickness carry on this family. Now everybody, now nobody do anything again. Now this is your prostate cancer or prostate BP, now all of us they deal with. Maybe when the man is going to the hospital, you have to follow him. That day, you will not go to work. Because when you go to Nigerian government hospital, it's the full day. Before you know, you yourself sometimes will not be feeling guilty. Am I treating this man well? This man may need more attention than I'm giving him. My job is not making me give better attention to this man. Should I resign? All those kind of thoughts will come. Next slide, please. The woman starts getting lonely, getting isolated. If even sometimes the man still have good sexual function and the man wants to say, auntie, now let us do something. I better go. For this kind of sickness where you get, and the only thing where you see they think, now you want it, you will be a young man. Now this only thing when your brain does the thing be that one. Next slide, please. Sometimes I said, there's now role adjustment. If the man is the breadwinner before, but because of the disease, may not be able to do enough to provide for the family. You as the woman, you now have to start doing that. You now find yourself doing akamu and come and be selling for your colleague. I say, this akamu, I made one myself, very good. You know they have to make when you want to make it just because you want to make extra fun to keep the family going. The woman yourself, as I said, you find yourself not sleeping well at night. Left like this. You find out that the financial burden of the family is now upon you as a woman. When you get married that day, the man says, I will bear your body. You will now find that now you can't bear the body. You will now find many things that you plan to do before you can't do. If you're someone that like traveling abroad, you can't travel. Even if you're like the type that like activity, like social activity, you are in different club, you can't be able to be. Even those in church, women leader, this thing, you used to like to wear ashwebi. When they bring their ashwebi, they say, I know they like to wear this. But it's not because you don't like to wear it, you are thinking of how you will use that money to treat your husband. Next slide, please. Then how will patients cope with the conditions you have prostate disease? One is to remain active. Still try and do much of your life activity the way you do it. Try to go to hospital. Medical care is still better than rehabilitation. Still better. Because science has really studied. Science has not gotten to them. Every day, new things are coming up. We are learning more. We are getting more. A lot of things that we can't do in Nigeria like 5 years ago that we can do now. A lot. Thank you very much for that. Then another thing about it is eating healthy. Eat a lot of fruits and vegetables. It helps to build your immune system. And when your immune system is there, your immune system fights infection and cancer. Next slide, please. Try and sleep well. Try sleep. If you find out that you're running up in the morning, disturb your spouse, try and get a new room or start sleeping in the parlor so that your spouse will sleep well. And when you have symptoms, please go to the hospital. Next slide, please. These days, access to information is at a click of your finger. Please use Google. I say use Google, I don't say use Google Doctor. There's a difference between using Google and using Google. Use Google to have information about the disease so that when you see the doctor, ask her, I read this thing, please explain better to me. And when you do that, because in Nigeria, even among them, there are quacks. When I say quack, there are different levels of quacks. There can be a consultant that is still a quack. Like if a consultant general surgeon decides to treat prostate disease, it's a quack. But when you read, you'll be able to ask him, what specialty are you? He will confess to you that I'm a general surgeon. So please, for this condition, they say it's a urologist, I will see. Which urology will you refer me to? He will refer you, we know that you are educated. And for we in the university environment, we should also be at top. Then, please, when you have problem, talk. Don't hide. Like the here we say, if you hide your disease will hide you. It's correct. If you hide your disease will hide you. So speak early. Talk to your spouse, talk to your children, talk to somebody that you have confidence in. Please don't talk to somebody that will carry your problem to CNN. People, it's hard to will laugh at you that they are involved. Talk to people that can help you. Seek for support. Next slide, please. Seek for support. There are people that can support you even financially. If you go to church, to your pastor, some pastors are very good. They can even carry you, they can help raise funds from the church to treat you. Talk to people. Then, focus on things you can control. Focus on things you can control. As it is, there is treatment for everybody. Both those that have rich money like Dangote and Otedola, and people that are poor like me. And when you get to the doctor will give you options. Not when the doctor gives you options. You want a hotel dollar treatment when your money is like your cycle money. Please focus on those things you can control. Take the kind of treatments your money can afford. You will still get to the desired end. Just that some parts of things that you don't like, they may cut you open. Which if it's Dangote, they won't cut him open. But the treatment definition is still the same thing. Next slide, please. Then, as I said, consult professionals and consider therapy that they will advise you. Then, next slide, please. For relatives, please have honest communication with your husband that is having the condition. Be open. Even you, what you are not happy about the whole thing, let him know. Two of you, it's for better, for worse.
The PSA, because everything you said resonates deeply within me, because I happened to take care of my dad when he was having issues as such as you discussed today. So he did his PSA and all of that, and there was nothing like malignant in the prostate and all that. And because of care and information, we were able to take care of him. Thank you very much. I want more advocacy on PSA for men. Thank you.
Thank you very much. Please, we want just question. If you have commendation and you can reach him personally, I'm sure we'll give you his contact because he has to go. Doc, please, you can quickly answer this question and then we'll go to the next one. Yeah, when I did 21 times a week.
21 times. I don't know how to answer this question, so I won't be in trouble with my gender. Okay. There is a study, one study that they've done that show that men, it's a study where in university, you know what research means. Research is not absolute. Research is not absolute. It doesn't mean what they got is exactly what it is. They did the research and found out that men that have 28, not 21, 28 ejaculate in a month have lower incidence of prostate cancer than those that don't have. To add that, if people that are young, when you were in your 20s and 30s, that is when that can even help prevent your cancer rate. By the time you are in your 30s, the cancer has started developing. And even if you have 100 ejaculates in a month, it won't prevent it. I hope we understand that. But I know that my gender, if we not tell her like that, many of them will wear iron pants. So that's why the men have held onto that, so that we may beg one at the help of. But the truth is, if that study is what it is, people like Reverend Fathers and the eunuch, we have more prostate cancer than the general population. Then from study, the incidence of prostate cancer is same among the eunuchs and Reverend Fathers, like the general population. That is the truth. Then some will tell you, if you take shower soap and pawpaw leaf, it prevents it. Yes, shower soap and pawpaw are antioxidants. They are very rich in antioxidants. Will they help? Yes, if you start taking it when you were 4 years old, not when you are 50 years old, or not when doctor have already diagnosed you of prostate cancer, it won't work. Then for the advocacy, man, thank you for that. We have fought for that several times. It doesn't work. Every year budget in the Federal Ministry of Health and in the State Ministries of Health, there is budget for health advocacy. But it's never done. Then the advocacy for breast cancer and cervical cancer is higher. And who are the people that propagate it? The men. The men will do everything for other people and won't do for themselves. That's how God has created them, if you remember Adam. So that's where we have. We try, and thanks to the churches, I think churches do more than government is doing. Churches from time they having men week, they call different people. They having women week, they call different people to come and give that talk. But the government own responsibility is for their advocacy, because that is actually their main one. They don't do it. The various Ministry of Health. So please, any other question?
Thank you very much, okay. Dr. Saibobo. We have one question from this place.
Good afternoon, everyone. I am Friday Usaite Guai, PARO Junior Staff Registry. Please, my question is this. I belong to an old boy association that does PSA every year. But it came to a point that normally everybody is given a clean slate. But one of us did it again in Port Harcourt, and now he's having the problem. And the doctor amongst us, we always say he doesn't trust the result from UBTH. And we have been doing it in union diagnostic every year, and they are not trusting the result too. Where do we go to really do this test?
The best location.
Thank you for that question. PSA. have a problem. The testing have a problem. I'm not trusting UBTH. Yes, UBTH at the time, our lab have a problem. Even me as a urologist that work with UBTH, I stopped sending my patient. I've discussed several, but now they are trying to sort it out. They are trying to sort it out. The best place to go, I hope I'm not selling them. I'm not supposed to do advance for them. But the best place, me, Dr. Saibovo, Emmanuel Saro, the best place I send my patient to is either Sinla, the one in Doctor's house, or Waytouch, because I've assessed them and I know them. But before now, we used to send patients as far as Agbo. There's a model lab in Agbo, which we send patients to just to get the appropriate one. But if I may tell you, PSA is just a pointer. PSA does not make any diagnosis. Even if it's not correct, it doesn't really matter. But when the doctor sees it, the doctor will do some other, he will examine you and do some other things. Some people can have prostate cancer and their PSA will be normal, although there are very few. So please, does not mean that all the other places where they've done the PSA is not correct. There are many things that we look into in PSA. And in PSA for us, the urologists, we don't look at the absolute value. There are other things we calculate to see whether it's significant or not. I hope I've answered your question.
Thank you very much, sir. One last question.
Thank you, Doctor, for your lecture. My name is Anthony Ayakami. You talked of ESA, but you don't talk of scan, prostate scan. I think that's another test too. And two, the treatment options. We were very economical about that. And the end result of each treatment option.
Thank you.
Okay. Sorry for those. Why I try to stick as much as I can to the topic. The topic is challenges of prostate disease in Nigeria. If I decide to discuss the various, as I told you, I discussed majorly 3 diseases. Their treatment options are different. Like the one for the infection, majorly antibiotics that we give. For the one I said is the fibroid of the prostate. That one, it can be drug, it can be operation. The operations are different types. When it comes to the cancer one, it can be operation, it can be radiotherapy, it can be drug, it can be different. Sometimes even for the cancer, we just tell the person, don't do anything. Because prostate cancer is a slow growing tumor. But some few ones will grow aggressively. But as a doctor, that's where God has us. We will not know which will grow aggressively. If I go into the treatment options, the topic will become boring to you because I will be going to area that necessarily you don't need. But when you do these simple things, you and your doctors will go further into that treatment option. Thank you very much.
Ladies and gentlemen, please come at this point, put your hands together to celebrate Dr. Usaro Emmanuel Usaibowo. Thank you for the awesome lecture. And the ANUPA chairman has been magnanimous enough to say that he knows that a lot of us still have questions, that he will put his contact on the ANUPA platform so that you have further questions, you can reach him. Okay, the registrar's rep has Dr. Usaro Saigowo. We want to deeply appreciate you for this topic you have given us. We know, just like you said, many people are into it now. It's affecting many people. And at least we are better informed. If at all, not husbands, uncles, brothers, we are better informed so that we too can at least pass on the information to them so that they could quickly, instead of they go and seek medical help. We appreciate you. And for all those people that will have questions, I think you just ask, maybe we'll compile them and we'll contact him. Please do with that.
to help us in answering them so that we'll be better informed. Thank you very much.
Thank you.
And please, let me use this opportunity to thank my senior DR for giving me, this is supposed to present first, but because I'm going to do an operation, I beg, and he mostly agree to allow me to present. So, thank you, Mr. Harris, and God bless you, sir.
We celebrate you, sir. Thank you. And I'm sure when we call on you today, next time you will come. We will tell our chairman to come and carry you. Okay, now time to receive and hear something about administration proper. Ladies and gentlemen, at this time, let us welcome our own Senior Deputy Registrar, Mr. Harris Osae. Please put your hands together, just be celebrating him as he's coming. Yes. He's going to tell you the tips on how to be on top of your game as administrators.
Thank you. Please sit down, sit down, sit down. My dear brothers and sisters, I want to refer to you as my colleagues. You're my brothers and sisters and friends. The slide on, or I read from what I have. Okay. The introduction. Our boss, the registrar, ably represented by my sister, Auntie Comfort, distinguished members of Association of Nigerian Universities Professional Administrators, Dividend Branch, ladies and gentlemen, I thank the organizers for inviting me to share my very little experience with this distinguished audience. Today's lecture brings to mind the view often expressed by artists who are engaged in visual arts. I've observed that anytime they talk about how people appreciate artwork, they are quick to note that we all look but see differently. I consider what I'm going to share with you today as a familiar terrain to all of us. Perhaps what could be new is the way it's presented. I hope the content of this lecture will strike a chord in some of us that will change your perception about your role as administrator in the Nigerian university system. The major focus of today's discourse is a call on all of us to push whatever we are doing to Olympian heights. Next. We can't be talking about we doing our work without identifying the tools we need to work. Like the farmer, of course the farmer will be talking about cutlass, hoes and all that. While the armed robber will be talking about gun, bullets, charms and all that. And of course, kidnappers will be talking about where to keep those abducted. Same way, we administrators will have our tools. Number one, pen and paper, of course, very important. I decided to point out number two. Of course, it's paper, but it's very unique. When I joined the university, I met a man who taught me very well, Mr. Anyaru of blessed memory. He made me to understand that anytime your boss invites you to his office, it's not to see how beautiful your suit is, it's to give you an assignment. So when you are invited, you hold your paper, you hold your notepad. You walk into the office and you are given an assignment, of course you jot it down. And let me also say this, I've seen that over time, especially for those of us who work closely with the Vice Chancellor. You may accompany the VC somewhere. The VC makes a commitment. He's not going to put it down anywhere. Your job is to put it down somewhere. When you get back to the office, put it in form of memo, get his approval and start to work. Same way too, you may be fortunate to be invited to a meeting. You are not going to be secretary. And then me go into the meeting, an issue arises. And your boss, perhaps the registrar, of course, you're not going to get up and walk through to go and tell you something. You just put something on the notepad. So to me, that should be your companion at all times. It helps to fast track your work. Dictionary, of course, you know, language, very dynamic. The context is different, depending on the message you want to pass on. And thank God we now even have it on our phones. Functional timepiece, very important, especially for meetings, for appointments. Event is slated for 11. Let's be frank, you have no reason to be there when it's after 11, even 1 second. I'll give you an instance. I think it was Mrs. Who, already it was Mrs. Obodo, she was SAR. A meeting was scheduled to meet with the DRO then, Mr. Anyaro, in his office. And then, when we got there, of course, maybe it was, let's say about 10, we got there some minutes to 10. It was 5 minutes to 10. And the people outside told us, no, you can't go in, because the time, of course, the man was very thorough. When it was 10, when we knocked, the door was locked. We were perplexed, how could be wrong? The man eventually opened the door for us. When we entered, he said, you people are late. We said, no, sir. He said, you people are late. We said, no, sir. Ah! He looked at the clock on the wall. And then he came back. Of course, in Jerusalem, called the secretary, said, when did they come? He said they came some time. The man looked at the clock, discovered that his was not too correct, and he actually apologized. That is the spirit. It's sad. These days, meeting is called for 11, people stroll in at 12. That's not administration. That is not administrator. For those who understand a little about defense, that is why if you have cause to work with the military people, time is very important. The reason is this: 1 minute a lot could happen. Because if you are there to release something and you are not there, a lot can go wrong. Safe cabinet for storing documents. This is very important. I've observed over time, in the last couple of years, that we are custodians of records. But we no longer keep records the way we are supposed to do. Truly, it is active. Something happened when early part of the year I was invited to Boston. It had to do with what happened when I was at student academy. On the way there around, what saved me, of course I'm sure you can recall this, what saved me was that by the time I was talking with them, they had gotten what the paper from the file, which Omere had presented to them. Am I lying? That saved us a lot of embarrassment. So it's not just about you, it's also about yesterday. Let me share somebody's experience. Professor Omu, I'm sure some of us can recall the late Professor Omu. He told me that when he was appointed commissioner in 1976, the old Benin State, while he was thinking of assuming duty, a man, a very foremost bureaucrat, is no longer alive. The man rose to become the head of the Western Region Civil Service. I'm sure some of you will have read about him. Late Chief Simeon Adebo. The man told him and said, listen, wherever you get to, for your first 1 week, don't do any work. Call for old files, new and old files, and read through them to keep yourself abreast with operations. And he said that thing he learned a lot from me. He told me that in the 90s, like what they say in local parlance, let's have a plan B. Put in place a feedback mechanism to be able to ascertain if your goals have been achieved according to plan. It's important. That's why the young seminarian went to university. Management of meetings. issuance of notice of meeting. Thank God these days we do have and soft copies. Thank God these days we do have and soft copies. You observe that some person will come to the meeting after taking the share, after sharing the register, they will just walk away. So it's important to deploy necessary logistics, including the registrars, although they are no longer available. Then of course, quorum for you so that your decisions are not declared null and void when the chiefs are down. Then clean up is an order, and then you leave the place the way you leave the place messed up. Even when he says he should lie down, he will place his legs on your head. Yes, of course, you accept it. So let me reiterate that again. It's one job that puts you in a domain for scrutiny. So be very, very careful. As secretary, you must guide members on the limit of the power of the committee as spelled out in the terms of reference. I will observe that somebody out of exuberance, he wants to tell you that he's close to the vice chancellor. No, yes, he didn't. It's so interesting. I am sure perhaps the last time he had one encounter with the vice chancellor would have been when the vice chancellor was even appointed. And this time around, the vice chancellor would have served, let's say he will have been in office for about 2 years. He wants to tell you that he's supposed to be vice chancellor. No! I was with the VC. No. This committee is supposed to look into this. As you as an administrator, just fine. And let him learn with his stupidity. Thereafter, enlighten him. That's why to arm yourself with appropriate information is very important, because it can throw you off guard. I also observed this. At times, he packs on an information to mess you up later. How? If at that point you don't know what you are doing, he misleads you. You do all the write-up. He's the same man that will carry that write-up. Go and tell Rachel and say, look at the man you people gave you. I'm being very frank with you. It's real. Very, very real. Never lose sight of your role as custodians of records and interpreter of laws and policies. Whatever assignment you are given, go and look for relevant laws and policies. It will guide your work very well. As secretary, you must not see your role strictly as passive, a person who is there to merely take notes and minutes. Let me say this to my younger colleagues. At a certain level, of course, you are given the role of member secretary. At a lower level, you are secretary. But let me tell you this. Don't see your role strictly on the basis of putting down minutes. That is why you must arm yourself. Put yourself in such a position that they will rely on you for information. When you make meaningful contributions, they will let you talk. At the inception of every committee, I'm supposed to go with you to your grave. Make no mistake, you are gone. I'm not kidding. You are gone. I'm not kidding. Because you can't be talking about hard decisions in an environment of rancor. So the health of the environment, a healthy work environment is very, very important for us to function well. More importantly, the building and sustenance of a healthy work environment is the responsibility of every worker. Possible threats to a healthy work environment, insufficient working tools, unethical behaviors, bad or wrong. Generational gap among workers, I'm sure you know what that means. You have up to about 5-6 generations, and of course, they all have different views and attitudes. Then, because the workforce is made up of a people from varied backgrounds and interests, then unfair treatment. Some of the things that help to foster a healthy work environment, avoid unethical behaviors, try to uphold the advancing there is strength in diversity. Effective channel of communication, both formal and informal. Strive to hone excellent interpersonal skills that will help you to work well and seamlessly with your colleagues. If you must stand up for your rights, please try to be polite. Be guided by the timeless message. Do unto others as we like others to do unto you. Be a good team player. Do not take all the credit for a job well done. Try to acknowledge the contributions of others. Let allocation of job and reward system be inclusive. I decided to add this, especially to those of us who are heads of units. It's not just enough to allocate job. Where benefits also exist, also allocate them. In the words of Professor Derabe, he will say, who they cry, they see. And no matter how small, let the benefits also go around. Don't think that those around you are not seeing it. Who they cry, they see. Looking into the future, to me, this lecture will not be complete without reminding ourselves that we live in a dynamic world where the only thing that is permanent is change. As administrators, part of our training is to be futuristic in our thinking. Therefore, we must brace ourselves up to handle challenges and opportunities that may come our way soon or in the foreseeable future. What should agitate our minds as we look into the future? Era of information and communication technology, especially artificial intelligence. Back in the days, in the 90s, we all talked about fast. We thought that was the ultimate fast machine. And now, again, we must prepare ourselves for it to be able to handle the opportunities and challenges that will arise from time to time. The University of Benin and future partnership. Yes. This is important. I've observed quite a number of partnerships. I also foresee where some of these partnerships may snowball into concrete investment, where you have the university partnering with the private sector to get things done. And of course, some of us administrators may have reason to be seconded there to work. This time around, your work is not going to be in the form of, oh, it takes you 1 week to prepare one memo. No. Your work will not be, your output will not be calculated by way of production, sales output, and revenue generated. Let me give you an example. Something happened in this university some years back. A colleague of ours, though it was an open advert, he applied to be the manager of Uniben Printing Press. That was in the 90s. He applied, he was found appointable. And of course, at the interview, he was given a target. If he wasn't a guy who was dynamic, I'm sure he would have fought that. Why am I saying this? Prepare yourself, you never can tell. That could happen to anybody. And of course, if I have invested so much in a business, I want to have good returns on investment. Where's some Mambo from late Nnamdi Azikiwe? He said, and I quote, at a relatively young age, I started to dream dreams and see vision about what the future had for me. And I began to believe that only those who have chosen to look beyond the level of mediocrity ever get to the top. Must life end within the confines of the University of Benin? Who says Duke Itoje can't be a minister? Who says Mrs. Hukun can't be a governor, or maybe a deputy governor? Let's assume that the men are in charge against it. Why not? Who says some of us cannot become pro-chancellors of universities? It's possible. Let me give you a classical example. Dr. Tony Radia. I knew Tony Radia back in the days as a broadcaster. Our path crossed very well when we were all active in Rotary Club. And then he rose to become the DG of NTA. Now he's what? He's a proprietor of a university.
Please be on your feet. Everybody, be on your feet. Thank you. And then now do this. Like this. Like this. So if your hand is touching touching the person next. Please do it. It's good for you. Thank you. Now do this. Like this. You can do it more rigorously. You can even. It's good for your feet. Thank you, ladies and gentlemen. Please take your seats. Thank you. Okay, there's something. You know, the ANUPA, we have a motto, and we've not been using it. We are going to learn it for those that are not aware. When you hear ANUPA, just like you hear greatest Uniben, everybody will say great. Great! You will say great. So for ANUPA, when you hear ANUPA, you will say Administration for Excellence. So we are going to go. Then when you hear Administration for Excellence, you now say ANUPA. So let's try it. ANUPA.
Administration for service.
Okay. Thank you, Chairman. So when you hear ANUPA, Administration for Service, so we are going to say it very vigorously and with zeal. ANUPA. Administration for Service. ANUPA. Administration for Service. Please put your hands together to celebrate yourselves. Thank you. Okay.
Perhaps we can add something to it. Service above self. Don't mind, just thinking.
Service above self. So you work, you think of what you can do for your organization. Don't even think about yourself first. Not that you shouldn't think about yourself, but don't think about yourself first. So for those of us that have questions, because we have the larger audience here, 2 questions from here, 1 from here, and then 1 from my right hand. So 2 questions from this place. For all the tips he's been talking about, I'm expecting a lot of questions. Anybody? Maybe I should stand on the podium so I'll see everybody's face very well. He's talked about a whole lot of things in the course of his lecture. He's talked about keeping relationship. You need to keep your relationship. If you are in exams and records, for instance, and then you need to do something in VCO, you should have friends. Yes, that will just fast track it for you, for them there. They will come and find it. That's want to do that to work. Find out how it can be done. You can do research. You can ask people. You can, even have someone from, other university, maybe someone that is in that department in another university. Something like that. Some people say, no, I will not burn my credit to be making calls, to be finding. Please, time has gone beyond that. Work has gone beyond that. Burn your credits. Burn your time. So we're expecting questions. I was just giving all these tips so that we can make up our minds. Questions, please. Or contribution. Any contribution? Okay. We have 1 from here. Question or contribution, Mark? Question or contribution?
Good afternoon, everyone. I'm standing on the existing protocol. Good afternoon, sir. I'm Ms. Obaze from Physics Department, ARO. Sir, please, I have, during the course of your lecture, I wrote so many things down, but there's one that I actually want you to explain more. When you talk about when you get to a new office, you go through the old files and the new files. So when the secretary in my department was posted, I was asked to assume and take the minutes of the Department Board of Studies meetings. So when I went through the minutes files, sometimes you see when they are taking their minutes, they refer to who made this suggestion, who made this contribution. I saw other minutes from other persons too, no names, or just go through the minutes, all that. So I was a little bit confused. So I was trying to ask some persons, is it right for you to put down the names of those persons that are making contribution or suggestions? So sir, I want to be clear so that I don't go doing the wrong thing. Then secondly, we just had our accreditation last week. And the NUC chairman that was there was asking, did we attend any lectures? I said yes, I'll be attending the registrar lectures. He now asked, where are your certificates? So, sir, I don't know if there's a certificate to any of these lectures that we normally attend, so that we can have things like that to present. Thank you, sir.
Okay, with regards to writing of news, truly, the reason why you're not supposed to point out who said this, certain things are supposed to be kept confidential, so that at times you don't spoil the mind of those who may read it in future. Unless if you're making reference to a particular assignment given, maybe to a subcommittee, you can say, oh, it's to the chairman of the subcommittee. Peter said this result should not be taken out tomorrow. No. That is why when you also take minutes, I'll share this with you. When I joined the university, I was in a video of things and directors meeting. And then I was asked to work with an older person. The man is later, one over years ago. So an interesting man. So the man, I said, sir, you mean we'll be writing what they are saying? He laughed deeply. He said, never mind, my young man. He said, what you are able to put down, it is as if that it was never said. That was his reply. But again, I have observed over time that persons are of different mindset. Some persons want to be on record that he came to a meeting in contribution. You see some persons, 5 persons, saying the same thing in different form. That is why meeting, when you are putting down a minute, it's supposed to be concise. Look into the main ingredient and put it down. So you don't have to put it unless when it is very, very important. Issue of certificate. I think that should be the responsibility of the field marshal of ANUPA to address. The field marshal of ANUPA certificate.
Question?
ANUPA, Administration for Service. You see, this certificate issue that we just raised, those are some of the things we want to even introduce. We are taking attendance of those persons that attend our functions. Even when we traveled to Abuja, one of the criteria we used was attendance. Now, we have statistics of those who attended last lecture series. This present one will still take the attendance, will make certificates available. It's part of training exercise. Like I said during my opening remarks, I said we are going to organize training programs. You know, I was asking, what's the difference between training and lecture? Do you understand? So we are going to do training programs for like faculty officers. Will do that in January. Others are coming up. I was just speaking with our DRE, our mommy here. We have a program in January. So as we organize program, we give certificate. This one is real. Though we have issues of funds, but by the special grace of God, we are going to get those ones done. I want to assure you that we are repositioning the plan.
Thank you very much, Mr. Chairman. This last question, and then we'll begin to round off.
Thank you for having me again. Please, I just want to, before I go to my question, I want to comment on this certificate issue. It's good that when we attend the trainings or workshops that we get certificates. But I just want to say that the idea of having a certificate shouldn't be what you drive us to attend. Look at now, we're supposed to have this place supposed to be full, packed full, because this lecture we were invited, administrative cadre was invited, executive cadre was also invited. Initially we thought that this place would not even take everybody. But I'm sure maybe if we had put in the invite that certificate will be issued, this place will be full. So let the certificate not be the main catch. The fact that you are coming for a training, that you will come to gain one or two things, that should be the center of attraction and to make you come. Even if there will be no certificate, come and attend. It's for your own personal benefit. So certificate is just an additional benefit, but the stuff what you are coming to get should be the main thing. That is for that. Then sir, my question. You were in as much as you have advised that we should be innovative to find out innovative way to get our job done. But we find out that these days now, we are encountering with people that are resistant to change. You know, when you are trying to bring about innovative things or getting things done, you find out that it's not working because there are people, that change you cannot bring about it on your own. You need, is to give and take action and reaction. So when that innovation that you are trying to bring is being resistant to change, you find that you are not able to, achieve the means. It's just that, for example, in the registrar's office, we service the entire university and we often have cause to, dispatch mails, So we now discover that it's often an equivalent task for the people that are in charge of dispatch. They practically go around the university like 4 times in a day. Because when the mail is ready going to faculty, it's urgent, please quickly go. As they're coming back, another one is going to that same faculty area again. So keep going and coming and the rest, So when I said, okay, we have email.
Let's say this. Why can't we have 2 motorbikes in the registrar's office? Why not? Why not? It will cost a fortune. And then, if possible, we devised something years back in the 90s. It's not over time. Those days, there used to be a driver at the VC's lodge who walked till 12 minutes, 1 a.m. 1 a.m. I'm not kidding. I remember when I was a PRO, there was a man I met there, was not a messenger. Mr. Adora, and then himself and John is late now. They were in this photocopying room. I called him and I said, Mr. Adora, I said, you have done so much working for the university and give you this liberty. Anytime you like, come to work. And if you come to work, sit down. I will get somebody to. That's why I got Corpus to be doing his job. Why am I saying this? Those guys those days will walk and walk into the night. The next morning, they were expected to be back at work. But again, there was a way to it. We used to have vehicle at VC's lot, 24 hours service. Even if you were living at Upper Sakoba, 2 a.m., the driver will take you home. There were times I would wake up in the morning, the driver would be at my doorstep. The Vice Chancellor, Professor Mokurayi, said, should get ready and go and meet the bursar. He will have contacted the bursar. The bursar will leave his house and wait for him in his office. How? Making preparation to travel with him. It's all about strategizing to be able to make this up. Sorry I have to say this. It's sad. There's too much laxity now in the system. Truly. Too much laxity in the system. If you have 2 bike riders, each bike can be assigned to 2 of them. One walked from morning till afternoon. The other one walked from afternoon till evening. Why not? And then let me quickly say this. Again, over time, we have decided to treat each other like brothers and sisters. But the laxity is too much. So, my sister, before we get to the next level, to me, we can solve it. It's just for us to deploy more resources, both human and material.
Thank you, sir. I think he deserves a round of applause. Thank you very much, and thank you everyone. I'll now call on the Vice Chair of ANUPA, person of Mr. Oseme Anao, for the vote of thanks.
Good afternoon, everyone. On behalf of the entire ANUPA ESCO, Uniben, I'd like to say a big thank you to our lecturers, our SDR for honoring our invitation, and Dr. Osaigogo for our left. And I'd also like to say a big thank you to our DROs, DRO Labor Relations for staying back up to this hour, and our DRO Senate Matters. Thank you very much. And every other person present here, I will say a big thank you to you all. And we hope that our next call, the number will be more than this. And when you are coming next time, please come along with at least one person. Thank you all. God bless.
Thank you. Please, can we be all standing now for the Uniben anthem, and then we take the national pledge. CRPU, please, can we have it on the screen? Lyrics of the Uniben anthem, and then lyrics of the pledge. Uniben anthem, please. All over the wide, wide world, our fruitful works unfold. What be so with joy and pride, we who are come on board. One heart and voice for all, we hear the purple cry of all. Arise, mighty Uniben, robed in your purple and gold, clad in your fatal green hand, knowledge for service unto. The pledge. I pledge to Nigeria, my country, to be faithful to real and honest, to serve Nigeria with all my strength, to defend my unity, and uphold my honor and glory. So help me God. Thank you very much, everyone, and please keep being good at your job. God bless you. See you in the next meeting. Thank you.